Today I'll be talking about a data visualization tool that can help young chronic pain patients in the self-management of their symptoms. The myWeekInSight application is specially designed for teenagers, taking into account different factors in their everyday lives like sleep and emotions that can influence their pain, while also considering their familiarity with data visualizations. The application allows teens to record multiple aspects of their daily experiences through an EMA survey and reflect on the same over time, while also sharing the results with caregivers and clinicians as required. Let's consider a scenario. 15-year-old Meghna, who suffers from chronic back pain, is visiting Dr. Berner's office. Armed with a stack of journals and binders, she tries to recollect her experiences over the past week. However, she is soon confused, unable to remember details like the times and days when she experienced pain. Dr. Berner and Meghna decide to collectively look at Meghna's journal entries to piece together the timeline, but they soon see inconsistencies and missing details in the data. Meghna is now stressed at having to remember to record multiple aspects of her experiences through the day. Dr. Berner is also worried as to how she can best diagnose and treat Meghna. She then recommends the myWeekInsight application. This web application, now implemented with health tech firm CareTeam, provides a single platform consisting of a survey and a visualization dashboard that can help Meghna record her daily experiences with minimal effort. Meghna can also see and reflect on her experiences in Dr. Berner's absence through the visualizations provided and share the results with Dr. Berner asynchronously. Meghna gets reminders twice a day to fill the survey. All she has to do is log into her CareTeam account. She can see her check-in form to be completed and simply click on Fill It. Designed by Drs. Caitlin Berner and Timo Belander, the 3 times a day EMA survey here captures data around Meghna's sleep, pain symptoms, emotions, mental health, and social interactions through a series of categorical and numeric questions. Once submitted, the myWeekInsight data visualization application visualizes up to a week of Meghna's EMA data through simple graphs, allowing her to reflect on her experiences anywhere at any time. When looking at the graphs, Meghna notices she has been getting less sleep through the week, which might have affected her symptoms. She decides to try and get more sleep going ahead. After a week, Meghna once again visits Dr. Berner. Together, they go over her visualization dashboard, which shows Meghna's data from the last 1 week. They review Meghna's sleep over the past week, able to see the times and the number of hours she slept, as well as the quality of her sleep. They also look at Meghna's symptoms, able to see what intensity of symptoms she has had, as well as which symptoms occurred when, and they can also see when Meghna took any medication for her symptoms. Meghna's emotions are also visualized in the form of weekly total bubbles and more detailed line charts to see trends and patterns. They also review Meghna's worries and mental health. The graphs show how worried Meghna might have been and what she might have been worried about, as well as how bad she expects things to be and how bad they really are. They can also see Meghna's social interactions, including days she went to school or not, her worries about interacting with her friends, and the quality of her interactions. These visualizations were designed over an 8-month iterative process after we interviewed clinicians, proxy users, math teachers, and people with previous chronic pain experience to make sure they were patient-centered and understandable by youth. Guided by these interviews, the visualizations utilize simple familiar graphs, are vertically aligned to allow comparison across charts, and use color coding to group categories like pain symptoms or mental health, ensuring they are understandable and engaging. The design process for these visualizations involved creating a low-fidelity hand-drawn sketches and then moving on to a medium-fidelity prototype in Balsamiq, followed by a final high-fidelity mock-up in React.js, which was then handed over to CareTeam for development on their platform. At each stage, the designs were validated with clinicians and viz experts to ensure we were designing a tool that would meet the needs of both patients and clinicians. We ran an initial design feedback study with 10 participants, all teenagers with chronic pain experience. Participants felt they would have liked to see patterns across weeks to reflect on how they could make their weeks better. They would also have liked to track symptoms and sleep the most, and that in general, having a place where you could track different things would be helpful. We're looking forward to implementing a larger study with 50 participants, where they will use the CareTeam platform to fill EMA surveys and view the visualizations of their own data. Post that, we will also be doing another round of design feedback interviews to assess the relatability and insightfulness of the visualizations. Thank you, and do reach out if you have any questions.